we did a lot with giving out halo sacks, to deal with SIDS. And we had to educate our nurses that before they left the hospital, especially those that needed, what we wanted to give out were car seats, and we found that to be irrelevant because a lot of our people didn't have cars. So why are we giving them car seats? But we do need to give them portable cribs, because that's where the need is. And I think that's what, when you start looking at the stats and start integrating, so what are the issues? And how do we get, as you were saying, down to drill down and figure out, so what is happening that is not necessarily on the radar? A car seat versus a crib, no one might think that that's an infant mortality issue.
Why in Lake County and in this region in general, we're seeing more of the maternal health problems at this stage. And I think if you did the same chart with low birth weight, you'd probably see that same kind of discrepancy, because it's, especially in this area, when you see that maternal health problem, it's going to be highly correlated with low birth weight. But there's so many things that go into low birth weight. And when you look at these numbers, you have to multiply that at least by 10 to see how many infants are setting themselves up for a life of risky health, more expensive health. And tackling the problem early on is, I think, something that we're fundamentally missing out on as a state. And whether that's political and funding, because I always feel like we're trying to patch the road with asphalt instead of building something that's sustainable for the future. And if we don't get to the root of things like poverty and mental health and addiction, then we're just going to be patching problems for all of that.
Infant mortality, 600 black babies die every year in Indiana. That is tragic. But again, you multiply it by 10 to your point, and that's the impact that we're having on the state of in terms of healthcare costs, in terms of lost Hoosiers who would be available in the workforce, in terms of the resources we have to dedicate to them once they're in schools to help them catch up and get through school. So when you're talking to private industry, when you're trying to get other people to the table, when you're trying to when you're trying to involve them, if one of your company's moms has a very low birth weight baby, and if baby's in the hospital for 6 months, that's tagging their insurance costs. That's mom not available there. That's mom's gonna have to be going back and forth to doctor's visits for years with that baby. So it goes much further than infant mortality. That's just the tip of the iceberg of the problem.